Welcome to episode 52 of Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're exploring pulmonary volumes and capacities. These are essential measurements that help us assess lung function and diagnose respiratory conditions. By the end of this episode, hopefully you'll be able to identify, define, and determine the values for the four pulmonary volumes and four pulmonary capacities, and ultimately understand how they reflect respiratory health. So let's get started. Pulmonary volumes represent the basic individual air volumes that can be measured during different phases of breathing. There are four key volumes to know. Tidal volume is the amount of air that moves in and out of the lungs during a normal breath. Tidal volume increases during exercise as breathing becomes deeper. This volume can be directly measured using something called spirometry. Next, we have inspiratory reserve volume, which is the maximum volume of air that can be inhaled after a normal inspiration. Inspiratory reserve volume can also be directly measured using spirometry. Third, we have expiratory reserve volume, which is the maximum volume of air that can be exhaled after a normal expiration. Expiratory reserve volume is useful in diagnosing obstructive or restrictive lung diseases. Expiratory reserve volume can also be directly measured using spirometry. The final volume is residual volume, and this is the amount of air remaining in the lungs after a maximal exhalation. Because it's the air that's left in the lungs after a maximal exhalation, residual volume cannot be directly measured, but it can be estimated through specialized techniques. Now, capacities are combinations of two or more volumes, and they help us understand the full range of lung function. Inspiratory capacity is the maximum amount of air that can be inspired after a normal expiration. So this is just tidal volume plus inspiratory reserve volume, and it can be directly measured. Then there is functional residual capacity. This is the amount of air remaining in the lungs after a normal expiration. So functional residual capacity equals expiratory reserve volume plus residual volume. Because it includes residual volume, functional residual capacity cannot be directly measured. Third, we have vital capacity, which is the maximum amount of air that can be moved in and out of the lungs. It can be calculated by adding inspiratory reserve volume plus tidal volume plus expiratory reserve volume. Because all three of these volumes are able to be measured, vital capacity can be directly measured as well. Vital capacity is useful in diagnosing obstructive or restrictive lung diseases. And then finally, we have total lung capacity. This is the total amount of air present in the lungs after a maximal inspiration. This can be calculated in a variety of ways. You can add all four of the volumes, so inspiratory reserve plus tidal volume plus expiratory reserve plus residual volume, or you can simply say it's vital capacity plus residual volume. However, since it includes residual volume, total lung capacity cannot be directly measured. These volumes and capacities allow clinicians to assess respiratory health. Abnormalities in these values can indicate conditions such as obstructive lung diseases, which include asthma and COPD, where airflow can be restricted. And then there are restrictive lung diseases. This includes pulmonary fibrosis, where lung expansion is limited. So to summarize, pulmonary volumes represent individual components of breathing. Pulmonary capacities are combinations of volumes that provide insight into overall lung function. Tidal volume, inspiratory reserve volume, expiratory reserve volume, and vital capacity can all be directly measured with spirometry. Residual volume, functional residual capacity, and total lung capacity all include residual volume and therefore cannot be directly measured. That's it for episode 52 of Pulse of Physiology. I hope this episode has provided clarity on how pulmonary volumes and capacities help us understand respiratory health. Come back next time for episode 53, where I'll discuss oxygen transport and how oxygen moves from the lungs to the tissues. Until then, keep questioning, keep exploring, and stay curious.